Effective tips to stop post-extraction bleeding. Pro techniques. Welcome to Health and Wellness Integrated Services, your trusted guide to health education made simple and practical. Today's topic is something every dental patient or caregiver should know: how to stop bleeding after a tooth extraction safely and effectively. We'll cover pro techniques that dentists recommend and real-world tips to help you recover smoothly at home. If you've just had a tooth pulled or you're preparing for one, this video could save you from unnecessary pain, panic, or a late-night trip back to the clinic. Let's get started. Why post-extraction bleeding happens. After a tooth is extracted, your body forms a blood clot to stop bleeding and start healing. But if that clot is disturbed, or if the pressure in the area isn't managed, bleeding can continue. Some common causes include talking too much or too soon after surgery, spitting or rinsing forcefully, taking aspirin or blood thinners, smoking or drinking alcohol, using a straw, suction breaks the clot, poor oral hygiene, or biting into hard food too soon. Knowing this helps you avoid the mistake before it happens. Pro techniques to stop the bleeding. Here are 7 highly effective tips that professionals use to stop post-extraction bleeding. 1. Apply firm, constant pressure. Bite down on a clean, folded gauze pad for 30-45 minutes straight. No chewing or moving it around, just steady pressure. Pro tip: if bleeding continues, replace the gauze and repeat. Use damp gauze. Dry gauze can stick and reopen the clot. 2. Use a moistened tea bag. If gauze isn't working, try black tea. Tannic acid helps constrict blood vessels and promote clotting. How? Wet a tea bag, wrap in gauze, and bite down for 30 minutes. 3. Elevate your head. Keep your head propped up with pillows when resting or sleeping. Lying flat can increase blood flow to the mouth and prolong bleeding. 4. Avoid disturbing the area. No touching with fingers or tongue. Avoid brushing the extraction site for the first 24 hours. Don't spit, rinse hard, or drink from a straw. Let the clot stabilize before starting saltwater rinses. 5. Cold compress on the cheek. Apply a cold pack or ice wrapped in a cloth to the outside of your face. 20 minutes on, 20 off. This reduces inflammation and helps slow bleeding. 6. Know what to avoid. Avoid hot drinks, spicy food, alcohol, and smoking for at least 48 hours. These irritants delay healing and increase bleeding risk. 7. Watch for warning signs. Slight oozing is normal, but active bleeding that doesn't stop after 2 hours needs professional attention. Signs of infection, swelling, foul smell, fever, or dry socket should also be checked by a dentist. What not to do after an extraction. Avoid these common mistakes: spitting too much, over-rinsing with mouthwash, eating crunchy foods like nuts or chips, touching the clot with your tongue, resuming gym workouts or heavy lifting too early. Remember, the clot is delicate. Treat it like a bandage. You wouldn't poke a healing wound, right? When to call your dentist. Call your dentist immediately if bleeding won't stop after 2-3 hours of applying pressure. You notice pulsing or pooling blood in the mouth. You feel dizzy or faint. Pain increases rather than subsides after the second day. You suspect a dry socket, sharp pain, and empty-looking socket. Tooth extraction doesn't have to be scary, and bleeding doesn't have to be dangerous. By following these pro techniques, you'll reduce the risk of complications and heal faster, pain-free. Let's recap. Apply firm gauze pressure. Use tea bags if needed. Avoid straws, alcohol, and rinsing too soon. Elevate your head. Watch for signs that need a dentist's help. Be gentle with your mouth, and your mouth will heal quickly. Like this video if you found it helpful.